Hey there, Dr. Brian McKay. I want to talk to you today about back pain. Yeah, back pain. Everybody's got it, and everybody's got a different way to treat it. Let me tell you something. There's no one single best way to treat low back pain. As much as everybody says there is, there isn't. So trust me on this one. You find something that works, stick with it. Yours may be different. Guy down the block can be different from what I do. If you get better, that's all we care about. Well, that's all I care about is you getting better. But I want to talk to you today about cupping. I had a patient come in and she was describing some pains, and I'm a chiropractor, so I do the chiropractic adjustment in addition to some physical therapy. And then I realized that she probably would benefit from cupping because she's chronic. Her back pain is chronic. What happens is the muscles in the lower back, which are really, they're not very big muscles. I mean, you're really supported more so by the pelvis and the larger muscles like the gluteus max and minimus, medius, um, tension fascia lata. Those are more, much more supported than the erector spinae, quadratus lumborum. I mean, those muscles are just not that big. So what happens is those muscles work harder. When you have a chronic low back problem, and everybody thinks, I have a muscle problem, I'm going to go get a massage, I'll feel better. Yeah, kind of, hopefully, but maybe not. When the pain's chronic, that muscle's working more. I wouldn't say 24 hours a day because when you're resting, it's not working. But when you're up, moving around, standing, doing stuff, you're going to feel pain. And that's what happens. So it's the problem's never solved. So you go get a massage, you feel good for a day, pain comes back. Problem not solved. Hello, got to wake up here. So when a patient comes in, one of the things I frequently do is, I only do it like once, maybe twice a week. I want to space it out. I use a technique called cupping. Now, cupping got its big, awake awareness level from Michael Phelps, the swimmer, who used it, and it leaves these unsightly, like hickeys, or petechial hemorrhaging, if you want the $5 word. But in any event, the petechial hemorrhaging or the hickeys are representative of you're drawing fluid out of a dysfunctional muscle. So that muscle's not working properly. And then what happens is the lactic acid, the byproduct when muscle fuel or glycogen gets broken down, is lactic acid and pyruvate, but we won't go to pyruvate. Lactic acid, everybody understands. So we stay with what happens now is the muscle has to still do its work, but it's not getting the garbage out. That's probably a better way. When the glycogen breaks down, you got to get the garbage. It's garbage. How do you get it out? You have to. It's called cell membrane permeability. So when it comes out of the cell, it goes into circulation, gets drained through the veins, out through, and meets up and gets out of your system one way or the other. So the idea here is a massage you're pushing in, with cupping you're drawing out, and it's a sustained drawing out. Now, at first when you put the cups on, it can be painful, but as it goes away, there's a level of effectiveness that you're not going to see otherwise. So cupping, typically, here's how I apply. There's a couple different ways. Chinese people have glass cups, and they light a fire to draw out the oxygen out of the cup. You have these cups today. You just put the cup on, and you lubricate the surface of the area you want to affect, and you just take the pressure out with the cup. It's like a reverse pump. It pulls the air out. You get a nice thing. You see the skin turn nice and red, and it will hurt. But the idea is, it's not like it's hurt you can deal with, but it's on the right spot. And then when the cups come off, there's this red like a hickey. Everybody remembers hickeys these days. And what then happens is the muscle starts to be able to return to a normal level of functioning, a more normal level of functioning, because you're getting the garbage out. Listen, you can't get the garbage out, you can have problems. So, listen, I'm Dr. Brian McKay, Core Health in Darien. We treat a lot of bad backs, and for some reason, backs are, there's no one single answer to any back problem. You know, as a chiropractor, I'm supposed to say the chiropractic adjustment. Well, sometimes it's not. Sometimes it's laser. Sometimes it's cupping. Sometimes it's a combination of all. Sometimes it's, physical therapy, massage. So I think what you have to do is you have to have a pretty big arsenal of tools to combat low back pain. And where we are, we treat cases in Stamford, Connecticut, Darien, Connecticut, Norwalk, and New Canaan. And that's pretty much our drawing areas. But I'll tell you one thing: if you got a bad back, give us a call. And the other thing too is, if you got a bad back and you want to call for advice, I have no problem referring people to where they got to go. It really makes a big difference. So my number is 203-656-3636, 203-656-3636. Give us a call. You got a question, I'm more than happy to answer. Dr. Brian McKay, Core Health in Darien. Have a great day.